scan of her brain, okay, and it showed us that there was a little bit of blood, okay, that had bled. However, what the biggest thing that we noticed was, I can show you, was an aneurysm, okay? And what an aneurysm is if you think of a tire, and have you ever seen a bubble on a tire, right?
Yeah.
And that's a weakness in the wall of the tire, right? And it's at risk to rupture, okay? So that's exactly what an aneurysm is it's a weakness in the wall that outpouches. And just to give you an idea, when it's 5 millimeters, when we measure it, and it's 5 millimeters of outpouching, that's when we start to consider doing some type of surgical procedure or intervention to kind of prevent that from rupturing, okay? Hers is 40 millimeters, okay? So she has a massive aneurysm. And so she was very, very, very high risk of rupturing. She did, but luckily or unlucky for her, she only ruptured a small amount of blood, okay? And so that gave us the opportunity to try to intervene on that very large aneurysm. Now, what I didn't understand when I spoke with you, but in reviewing the images more and in speaking with one of the neurosurgeons, what we think happened is that blood, okay, ended up, that blood went somewhere, right? And in our brain, we have the two sides of the brain. Deep in the middle is where we produce what we call our spinal fluid, okay? And it is made in here and then it travels down a little tube, and then it kind of bathes the outside of the brain and bathes our spinal cord, okay? Now the cells that are deep in here that make it, that's their only job, is just to make spinal fluid. They don't know if there's a blockage below, okay? So they just keep making it. And as we know, our skull is a closed space. It does not stretch. It's a bone. And so if it keeps making that fluid has to go somewhere, right? So you have to make space. So it starts pushing on structures of the brain to make that space, okay? And so that blood, the little bit of blood that she bled when it ruptured slightly, we think blocked off some of that fluid from going down, which is why she had to get a drain, okay? And what the drain does is it goes right to where those cells produce it, so that rather than the spinal fluid having to go down, it gets to kind of be drained out, okay? So it doesn't. However, unfortunately, that pressure had already built up, okay? Before we could get there to put the drain in.
Right.
Okay. And so that pressure caused the aneurysm to push on vital structures, including the artery that gives the blood to the left side of her brain, as well as part of her brainstem. Okay. And so, although we drained off that fluid, she did not have blood flow.
Right, the damage was already done.
And did not have oxygen to those portions of her brain. When you don't have oxygen getting to portions, that tissue dies. And so this is the scan that I was going to show you. Sorry, this one. Oh, I was going to show you, sorry. So this is her aneurysm. I click it, right? I didn't get to show you this, I'm sorry. That's the aneurysm.
Wow.
This big bubble. So this is our carotid. Okay, so that big vessel that you feel pulsing in your neck, that's that. So in comparison, it's pretty big, right?
Yeah.
But this is way bigger.
Right.
Okay, so it was a very large thing. Now what they did was they tried to put coils in, and they were successful in that. That procedure was successful. And the idea of putting the coils into the aneurysm is to block off. So basically, rather than having this communication into this pouch that the blood flows in, and if it gets high enough pressure, it would burst, right? So rather than having that, if you put coils in there, it blocks it off so that it becomes this, right? So that's still there, that bubble, but blood can't flow into it.
Okay, right.
Okay, makes like a wall, so that, and that was successful. But as we talked about, what another issue, still the same issue somewhat, related to the aneurysm was that blood that bled before that had blocked off that spinal fluid. Okay, and so we got that drain in, but the damage was done. And so that's what we're seeing. Okay, so the damage that we have found is this. So just to orient you, this is as if, we'll start here. This is as if we're standing right where we're at, actually, at her feet, okay, and looking up at her, okay, and what it's doing, you can see kind of over here where this line is, that's the slices, so it's taking a photograph, looking down at that, there, and we're gonna scroll up, okay? So because this is us standing at her feet, this is her left side, this is her right side, this is where the pillow is, this is where her face is, okay? So as I scroll up, it's just a slice, and we'll look at it. So this is the back of her brain, okay? As we scroll up, you can start to see her eyes, right? So this brightness is the area of dead tissue.
Oh, wow.
So that's the area of her brain that is unfortunately dead. Okay, so as we go down, you see brightness over here too. So our brain, as you see, it's this whole area. It's like almost the entire left side.
Right.
So the left side controls the right side of our body.
Right.
Okay, so that would mean that she cannot move the right side at all. Okay?
Right.
Unfortunately, the aneurysm is right here, this big black thing, okay? And it pushed on this thing, which happens to control the motor or movement of the left side of the body. So this leaves her with the inability to move any limbs. And as we talked about on the phone, you know, anytime you have any type of injury, you get swelling. Okay, so if I rolled my ankle, it would swell. And it can, because there's nothing pushing on it, right? Or stopping it from swelling out. For her, we have the skull. Again, that's our limiting factor. And so we know that this will swell. And there's nowhere for it to go. So what happens is it starts to push on this side, which then damages the other side as well. And it starts to push down on what's called our brainstem, where she has some damage already. And the brainstem is the most important part of the brain, because it connects our brain to our body and our body to our brain. It also controls our breathing. It controls our ability to swallow. It helps to control our heart. And so as we push on that, that is when people pass away. Okay? And so, you know, you read to me her living will. And in reading her living will, the things that she would be unable to do because of this damage would not be consistent with how she wants to live.
Right.
What she would deem an acceptable quality of life.
Right.
And so for that reason, I 100% agree. We should be focusing on her comfort rather than trying to intervene more. Okay? So we're going to continue to support her until, you know, if the other family can come, you know, hopefully soon. You can just keep me updated and let me know
Her
when you think they'll
sister
be
and
here.
brother said that they're leaving this evening. They're coming from Alabama, so they said they should be here by the morning.
Oh, okay.
Okay.
And they can rest. I mean, they can come in the
Okay.
afternoon. So it's best to be here, kind of, you know, when we're here, the main team.
Okay.
Because we can explain all of this. Okay. There's always physicians here 24 hours a day. However, after the main team leaves, because we can't be here 24/7, unfortunately, they are a coverage team, meaning they know about her and they know how to intervene if necessary. They are physicians as well. They know what to do when things go wrong. But as far as the ins and outs of her, you know, the process of what happened and why this happened and whatnot, that's best for us to answer because we've taken care of her directly.
Right. Okay.
Okay. So we are here tomorrow from 7 a.m. until 3 p.m.
Okay. I'll make sure that if they have questions that they're here during those hours.
Yeah.
And I'll try to make sure I'm here as well, because I don't want there to be any issues.